How to approach a case with suspected pulmonary embolism? A person presents in ER with pleuritic chest pain and we suspect pulmonary embolism. What would be the next step? There are two important things that guide us toward the investigations. These are the Perk Score and the Wells criteria. Perk Score depends on age, prior history of DVT or PE, recent trauma or surgery, hemoptysis, exogenous estrogen use, and then some signs that we have to see: the heart rate more than 100, saturation less than 94%, and clinical signs suggesting DVT. If the score is 0, we can rule out the PE. The second is the Wells criteria. Wells criteria identifies the probability of having the pulmonary embolism. In Wells criteria, we have to ask about the previous history of DVT or emboli. We have to assess for the heart rate, clinical signs of DVT, hemoptysis, and if the alternate diagnosis is less likely than PE and patient has the cancer. Wells criteria identifies the probability of having PE. If score is 0 to 2, there is the low probability, and if more than 6, high probability of having pulmonary embolism. Now, as we have assessed the Perk score and the Wells criteria, we can decide for the investigations. If the Perk score was 0, we don't need to go for any investigations. But if the Wells criteria was low probability, we'll go for the D-dimer. If there is the moderate or high probability, we'll go for the pulmonary angiogram.